Welcome to the Diabetes Prevention Workshop, hosted by Luminous Health. Today, we're going to be talking a little bit about type 2 diabetes and ways that we can prevent it. Before we get started, I'd like to talk through a few statistics. More than 29 million Americans are living with diabetes, and of those, 1 in 4 doesn't even know that they have it. When you have type 2 diabetes, your body does a poor job of turning the carbohydrates in your food into energy. This causes sugar to build up in your blood. Over time, this is going to raise your risk of heart disease, blindness, nerve and organ damage, and other serious conditions. It can strike people of all ages, and often the early symptoms are mild, which is why about 1 in 4 people don't know that they have it. Another 86 million adults, which is more than 1 in 3, have prediabetes. And this is where your blood sugar levels are higher than normal, but they're not exactly high enough to be classified as type 2 diabetes. If you don't get any weight loss or exercise moderately, 15 to 30% of people with prediabetes are going to develop type 2 diabetes within the next 5 years. Some health habits and medical conditions related to your lifestyle can also raise your odds of having type 2 diabetes. Some of these might be things like being overweight, especially right around the waist or your midsection. If you live what we would call a couch potato lifestyle, where you're sitting a lot, you're very sedentary. If you smoke, maybe you eat a lot of red meat, processed meat, high fat dairy products, and sweets, or you may have unhealthy cholesterol or triglyceride levels. Other risk factors that unfortunately are out of our control are going to be things like our race or ethnicity. So, Hispanics, African Americans, Native Americans, and Asians are more likely to be at a risk of developing type 2 diabetes. If someone in our family has had type 2 diabetes, whether that be a parent or a sibling, that's also going to increase our odds of developing type 2 diabetes. And then, unfortunately, our age. If you're over 45, our risk automatically increases. So, unfortunately, the more risk factors you have, the more likely you are to develop type 2 diabetes. Now, for those of us who are women, we have some other things that we need to look out for as well. So, we are also more likely to get type 2 diabetes later on in life if you had gestational diabetes when you were pregnant, maybe you delivered a baby that weighed over 9 pounds, or if you had or have polycystic ovary syndrome. So let's talk about how insulin actually works. So we hear a lot about insulin in regards to type 2 diabetes, but what is it? What is its job? And how does it relate to type 2 diabetes? So, in a healthy person, insulin helps turn food into energy. Your stomach breaks down the carbohydrates from our food into sugar. They go into our bloodstream, and then it tells our pancreas, "Hi, can you release this hormone called insulin?" It's going to help our cells use this sugar for fuel. So in type 2 diabetes, our sugars might stop responding to insulin, which is where you've heard the term insulin resistance. The pancreas might stop producing enough insulin because it's being overworked, or maybe the insulin just isn't working or functioning as well as it used to. And that's what we typically see when we have type 2 diabetes. Now, what happens is sugar gets left in our bloodstream because the insulin isn't working properly, bringing it to our cells. And what this does is we have less energy or fuel for our organs to function properly. And that's when we start to see certain health issues as they relate to type 2 diabetes. So, how is it diagnosed? Well, there's two different tests. There's a hemoglobin A1C test and a blood glucose test. So your doctor might take some blood work, maybe at your annual physical or if you see them regularly. Um, and they're going to take a look at your A1C or your hemoglobin A1C. This test shows your average blood sugar level over the past 2 to 3 months. If you already have symptoms, your doctor might also do a random blood glucose test, which typically is like a finger stick. And this is going to tell us what your blood sugar level is right at that moment in time. So let's talk through a couple of complications with type 2 diabetes. So, again, these are reasons that we want everyone to be preventing the progression of maybe prediabetes, or if you have some high blood sugar readings, from going into full on type 2 diabetes, because there are several complications that come along with it. So, if you don't treat diabetes with a healthy diet and exercise, you're more likely to get plaque in your arteries than people who don't have this problem. The sticky substance is going to slow the blood flow and increase your risk of having blood clots. It leads to hardening of the arteries, which is going to make you more likely to have a heart attack or a stroke. So, about 2 of 3 people with diabetes die of heart disease because of this particular condition. Now, kidney complications, we've probably heard of this before, but the longer you have diabetes, the greater chance you'll get chronic kidney disease. Controlling your blood sugar, blood pressure, and cholesterol can lower your risk for this complication. Now, what's important is that our kidneys do all the filtering out of our system. So when we have all of this blood sugar left in our system, or all of the sugar left in our bloodstream, the kidneys have to work on overdrive, which is why over time it can lead to kidney disease. Now, sometimes it even affects our eyes. So, high blood sugar can damage those teeny tiny little blood vessels that bring oxygen and nutrients to the retina, which is a critical part of our eye. This is known as diabetic retinopathy, and it can lead to vision loss. It's the leading cause of new cases of blindness in people between ages 20 and 74. We've probably heard of diabetic nerve pain. So, over time, uncontrolled diabetes and high blood sugar can cause nerve damage. Symptoms might include tingling, numbness, pain, that pins and needles sensation. And that's typically found in our fingers, maybe our hands, toes, or feet. The damage can't be reversed, but there are treatments. Controlling your diabetes can prevent further harm. Foot injuries, this is very important as well. So, with diabetic nerve damage, it can make it hard to feel our feet. So, you may not notice if you get a cut or a wound. At the same time, hardening of the arteries reduces blood flow to the area. So, even a small injury can cause foot sores and gangrene. In severe cases, infections can cause amputation. So it's very important that if we are dealing with diabetes and we know we have that diabetic nerve damage, that we are always checking our feet for cuts and scratches and make sure they stay clean. All right, something I think that we typically forget about are our teeth and our gums. So high blood sugar can feed the bacteria that make plaque. Plaque buildup leads to cavities, tooth decay, and gum disease. Severe gum disease can cause tooth loss. It weakens gums and the tissues and bones that hold teeth in place. This makes it easier for us to get an infection. So, that all sounds like really terrible news, right? So, let's talk through some things that we can do to help prevent from getting to this place. First and foremost, our diet makes a huge difference. You can control your blood sugar levels by changing your diet and losing extra weight. That will also cut down our risk of other complications, such as the ones we just talked about, and other chronic diseases as well. So, what exactly is a healthy diet? Well, it's pretty simple. A healthy diet is just a way of eating that's going to help to reduce the risk for complications like heart disease, stroke, and diabetes. Two key takeaways here is that we want you to include a variety of different foods. Make sure you watch your portion size because that is the key to the healthy diet. And then the other important thing to remember is to choose foods that are rich in vitamins, minerals, and fiber over processed foods. So these are just a couple of examples, and we'll jump into these a little bit more. But healthy eating includes a wide variety of foods like vegetables of all different colors, shapes, and sizes, whole grains, fruits, non-fat dairy products, beans, lean meats, poultry, and fish. So non-starchy vegetables, this is really important to remember. We want you to eat at least 3 to 5 servings of vegetables a day. Okay. And to remember, serving size, we said that was very important. So, understanding that 1 serving of vegetables is about 1 cup of raw vegetables or a half cup of cooked vegetables or vegetable juice. Just be careful with the vegetable juice because sometimes that can be high in sodium. Just so you have a couple of examples, some non starchy vegetables might be things like asparagus, broccoli, carrots, leafy greens, onions, tomatoes. The list goes on, and you can certainly search online for examples of non starchy vegetables. Now, proteins. Proteins are very important as well. We want you to get about 2 to 5 ounces of meat, and the best protein choices are things like plant based proteins, maybe fish and seafood, that's very important, chicken and other poultry. And if you're eating chicken, try to eat the light meat instead of the dark meat. The dark meat tends to have a little bit more fat. Having reduced fat cheese, and then eggs. Eggs are really great sources of protein as well. And then, just as a visual, 1 serving size is also about the size of a deck of cards. So, carbohydrates. 1 serving of carbohydrates is about 1/3 to 1 cup of starchy food at each meal. And we will go further into carbs because there are a couple of different types of carbohydrates that we need to address. So, as mentioned, there's different types. There are 3 main types of carbohydrates in our food, including starches, sugars, and fiber. Now, it's really important that we get comfortable with reading the nutrition label because this is where we can understand and see how many carbohydrates we're actually having and of what type, right? Now, just as a rule of thumb, and please write this down if you have a pen and paper, if you're one who needs to track their carbohydrates, women need about 45 to 60 grams of carbs per meal. Men need about 60 to 75 grams per meal. So foods that tend to be high in starch are going to be things like, in the vegetable category, things like peas, corn, lima beans, potatoes. And I try to, if I have to guesstimate, I try to think about the texture of those foods in their purest form. So when you smash a pea or a lima bean or even a potato, it almost has like a mushy, grainy kind of texture to it. So that's a good way to sort of estimate. But if you're not sure, you can always look online to see what's considered a starchy vegetable. Other starchy carbohydrates are things like beans, lentils, black-eyed peas, split peas, kidney beans, the list goes on. And then, of course, grains like oats, barley, and rice. Now, sugars. Sugars are carbohydrates. We have naturally occurring sugars, which are where we find them in things like milk and fruit. And we also have added sugars like things that have heavy syrup or things like regular sugar that we add to cookies. Now, it's important that we keep an eye on our sugars because even if we're eating those naturally occurring sugars, our body still reads it as sugar. So it doesn't matter if it's added or natural, sugar is sugar is sugar. So we still have to watch our portion size and reduce the amount of sugar that we're eating as much as possible. Now, fiber. Fiber is really important as well. So fiber is an indigestible part of plant foods, which contributes to our digestive health. So really, most Americans are not getting the recommended amount of fiber in their daily meal. So at the bottom here, you can see it's recommended that adults aim for 25 to 30 grams of fiber each day. And what this does, it helps to keep our bowels regular, helps to reduce our cholesterol levels, and it's going to help us to feel full and satisfied after eating for a longer period of time, which is really important if we're trying to cut back on snacking and help us get from one meal to the next. Good sources of fiber are going to be things like beans and legumes, fruits and vegetables, especially if you can eat them with the skin on. So, eating an apple with the skin on, um, great. But as much as you can do that, it's going to increase your intake of fiber. Nuts and seeds are great as well. And then any type of grain that we can switch from a white source to a whole wheat or a whole grain source is going to be a really, really good way to increase that fiber. So instead of having regular white pasta, maybe we can switch over to a whole wheat pasta. Whole grain cereals are wonderful. And then breads, if we can switch over from plain white bread to some type of whole grain bread, that's going to be a huge difference in your daily intake. So one method we'd like to show you is called the plate method. I'm a person who likes visuals. It depends what you like or what helps you to learn. But essentially, we want you to put a line down the middle of your dinner plate, and on one side, it's going to be the whole half of that plate is going to be vegetables, non-starchy vegetables. On the other side, you'll see it's broken into two sections. A quarter of your plate should be a whole grain of your choice, and the second, at the bottom, the other quarter of the plate should be a healthy, lean protein of your choice. So just a couple of diabetic superfoods, we like to call them. What that really means is just that these are foods that have a low glycemic index and they provide key nutrients. So essentially, they don't spike your blood sugars, they keep it at a manageable rate. And again, they have lots of vitamins and nutrients. So feel free to take a look at this slide, make lots of notes. We have any kind of beans, green leafy vegetables, berries, tomatoes, whole grains, fat-free milk and yogurt, and fish. Fish is really great because it has those omega-3 fatty acids. As I've mentioned before, portion size is really important too. So we have to figure out a way that works for us when it comes to tracking how much we are eating. So you have to look into your kitchen and understand your daily routine and understand what works for you. So do we use measuring cups and spoons? Do we use a kitchen scale? Do we get familiar with reading the food label? Or do we use a calculator? Or do we use an app on our phone? It really depends what works for you. Tracking your eating or recording it. So it's really good to be specific. So we want to record what, when, and how much it is that we're eating. But where do you record it? Again, that's up to you. Everyone has a little bit different of a preference. So maybe you like using pen and paper, so you just have a spiral notebook. Maybe you like making a spreadsheet. Again, lots of apps on your phone. Maybe you just take a picture of what you're eating on your phone so you remember. Maybe you do a voice recording and you talk about exactly what's on your plate, including the portion sizes. But when you do all of these things, make sure you write down as many details as possible. Exercise. So moving on to moving, right? Exercise is so critical. Regular exercise like strength training or walking is going to improve your body's use of insulin, and it can actually lower blood sugar levels. Being active also helps get rid of body fat. It lowers your blood pressure and it can protect you from heart disease. So we recommend that you try to get 30 minutes of moderate activity most days of the week. Most meaning about 5. So 30 minutes, 5 days a week. Or you can aim for 150 minutes of moderate activity and break that up however it works with your schedule. Relaxation, something that I think a lot of us are not very good at doing for ourselves, right? Because we're so busy caring and doing and being for others. So it's really important that we work this into our day. Stress can actually boost your blood pressure and your blood sugar. Some people don't do anything for it at all. Others turn to food to cope with it. And instead, we really need to practice relaxation techniques like deep breathing, meditation, or even visualization. Talk to a friend, a family member, a counselor, or a religious leader. That could help as well. And if you can't beat it, reach out to your doctor because they will have lots of other recommendations or resources for you as well. So the age-old question, can it be prevented? Well, we can certainly lower our risk because as we talked about in the beginning, some risk factors we can control, some we cannot. So to lower our risk, we need to follow the same guidelines that we would follow in order to ward off heart disease. Okay, so focusing in on eating that healthy diet, exercising for 30 minutes, 5 days a week, or breaking up that 150 minutes, however it works with your schedule. Staying at a healthy weight or getting to a healthy weight, right? As soon as you just need to start the process. And then, of course, talk to your doctor about being tested for prediabetes. If you're not sure where you stand, ask your doctor to check it out for you. People with prediabetes can avoid getting diabetes with lifestyle changes, and in certain instances, depending on, it's very personal. Some people need medications to help get that down temporarily, and that's okay. So that is the end for this presentation. But if you have any questions at all, please feel free to send us an email to luminouscommunityhealth@gmail.com. We are available to you, and if you have any questions, please do not hesitate to reach out. I will leave this up for just a moment so you can write down the email address. Again, it's luminouscommunityhealth@gmail.com. And last but not least, if you could do us a huge favor and scan this QR code. So just pull out your smartphone, turn on the camera feature, and hold it up to this little black box and click the link that pops up. It'll take you to a short survey that will let us know what you've learned in regards to this presentation. And it'll help us to be able to share this with others or maybe make some changes if you have any suggestions. So please, please, please go ahead and scan this QR code and let us know what you've learned. I want to thank you so much for joining us today. You can always come back to this link and rewatch the video should you need a reminder, a refresher, or if you have any questions. Thank you again so much, and we look forward to working with you again soon.